All right, we're gonna go ahead and get started. So, of course, thank you all again for joining us. My name is Christopher Jammer, and today we have with us Dr. Dino Pappas and Chris Norris, his recovery specialist, who are going to talk to you guys today specifically about some muscle and joint pain that a lot of people can relate to called back pain. So before we actually get into the content of the presentation, we're going to go over some housekeeping items. So as you guys saw, whenever you admitted into the presentation, all of your microphones were muted, and that is so that we can cut down on the background noise and get you guys all the information as quickly and as efficiently as possible. If you have any questions, you can for sure shoot those over in the chat function. But as you will notice that as we go through the presentation, there's going to be a QR code on the different slides, and that's going to give you guys access to what we call our virtual injury and pain chats. So that's going to be a one-on-one chat with one of our providers if you have something really specific that you would like to ask one of our doctors, or if you want something a little bit more private where you don't ask a general question to the general population or the general group that's going to be on here, you're more than welcome to scan that QR code and schedule a time that's going to be more efficient for you guys. So for those of you all who are unfamiliar with us, Airrosti, we are a healthcare provider group that specializes in treating what we call soft tissue injuries. So that could be anything from your head to your toes, as long as it's not a broken bone, a fracture within the bone, or a full thickness tear. It's going to be something that we can take care of either in office or on our virtual platform. So not only do we fix a lot of these conditions whenever they come into our offices, we also like to do these webinar kind of wellness talks where we talk to you specifically about different conditions that we see every day and try to help you be preventative and proactive in your healthcare. So in essence, teaching you how not to need us, but in the event that you do, we are here as a resource for you. So today, Dr. Pappas and Chris are going to talk specifically about lower back pain, give you kind of the synopsis of where lower back pain comes from, and then give you some preventative and some tips to keep you moving as efficiently and as quickly as possible. So without further ado, I'm going to turn it over to Dr. Pappas.
Hey guys, I want to say thanks for joining us on this overcast Thursday afternoon. One more day, weekend's here, so let's get this party started.
So we're going to talk. Yes, sir. I'm sorry. Before you get started, I forgot to mention. So for all of you all who are on the presentation, if you have access to the chat, can you send me your first name, last name, and your employee EIN number so that we can get you guys your wellness points from Austin ISD wellness people? Thanks.
Awesome. Thanks, Chris. So looking forward to doing this presentation. You'll see pretty quickly that back pain, especially back pain, radiates into the legs and interferes with the quality of your life, is an epidemic in the United States. So if we can give you a couple simple pointers to try to alleviate the back pain or reduce its intensity and severity, trying to make you guys get a little ahead of the curve here. So why are you living with low back pain? We're going to go over some facts. We're going to go over some misconceptions. We'll give you about 2 or 3 simple exercises, and we'll do our best to answer any questions. If you have a general question, please feel free to ask it. Excuse me, but more specific questions, we ask that you refrain from giving personal health information, anything specific to you over the context of this. That's why I have the virtual chat option. Next slide, please. So what is back pain? Back pain, leading cause of disabilities in the world, not just the United States. In other industrialized countries and non-industrialized countries, back pain also is at epidemic levels. It's estimated that Americans, about 85% of Americans, so 8.5 out of 10, will have an episode of back pain. And of that, greater than about 50% will have a disabling form of back pain. With disability is it interferes with what you need to do to function in a normal day. So 85% statistically Americans will have back pain, and over 50% of that 85% will have disabling back pain. That's a huge, huge, huge number. This pain can interfere with normal activities, sitting, standing, squatting, playing with your kids, the quality of activity lives that you do, walking, hiking, fishing. That's no fun when it starts to interfere with your daily stuff and the things that make your life awesome, enjoyable, and amazing. Statistically, about 5% of people, if I have 100 people in the room with me and 100 people have back pain, 5% will need surgery, but unfortunately, surgery is being recommended at a much higher clip in the 15 to 20% range is what estimates say for back pain instead of that 5%. So unfortunately, for years and years and years, the medical community has mismanaged, mistreated, and given you wrong expectations about back pain, which creates a lot of fear, and that fear can impact your outcome, how you do once you have back pain. There's patterns to back pain, local, where it's in a couple specific spots. You can point to it with one finger. Diffuse, you take the palm of your hand and you say it's over a specific segment. So it's in a general area rather than one specific spot. So I'm gonna use my shoulder. Local, it hurts me here. Pinpoint, diffuse. Use the palm of your hand, it hurts me in a region. Radicular, that's nerve pain. Nerve pain's not fun. That's electric. Numbness, tingling, burning, pins and needles that radiates either down the arm or in the case of back pain, radiates down your leg. And then there's referred pain, pain that's sent from one area of the body to another. Sometimes these things are complex. Sometimes it's hard for patients to figure out, and even doctors, humbly I say this, doctors to figure out. That's what we do at Airrosti. We spend about 30 minutes in evaluation and consultation on the first session, and we try to figure out, is this a local problem? Is this a diffuse problem? Is this a nerve problem coming from a different source? Or is the pain sent from one area of the body to another? So misconceptions about back pain. We've heard it from folks, and usually, you know, in office, I listen to it, I understand the context, but you don't have a bad back. When you automatically assign yourself a label, sometimes you get mentally defeated. So I like to think of human beings as strong, robust, durable. And we like to think of that and switch the mindset from I have a bad back to you have an injury that you can get over this episode. So that mindset shift is important. Another misconceptions, discs don't slip. I've heard it, and I usually let patients, roll with it, but discs don't slip. They are thickly and strongly anchored to the vertebra, the bone on top, the bone on bottom, and the bone on the sides. And for a disc to slip, the amount of stress and pressure that it would cause would be catastrophic for your spine. So the reality is the disc doesn't slip, the tissues can get aggravated and irritated, but the disc does not slip out of place. That's often a fallacy that occurs. And another misconception, your low back as a cause of low back pain. Sometimes it is, but sometimes other things can trigger back pain. And that's one of the things that we do. Is the low back the cause, or is it the effect of something else? And what we need to do is find that and assess, treat, and take care of that problem. So again, not all low back pain is from the low back. That's one of the things we're trained to do. And we try to spend at least 30 minutes trying to figure out, is this cause or effect? Next slide, please. So parts of your body, and when an area of your body is not working too well, another area of the body will try to cheat and compensate for the problem. So if you have a team, and the team is a rowboat, and people are rowing the race, and you got one person lagging behind, the other 4 people on the team, if there's 5 people, are going to try to row faster. They're going to be doing a ton of work for that one area that's misbehaving. And the back is the same way. And if you look at the pictures on the right of the screen, you'll start to see lines and diagonal lines and arrows and stuff. And all that is fancy words for the body creates unique ways of cheating and compensating around the problem. Sometimes those compensations itself are the area of pain, but the cause can be in a different area. And at Airrosti, we have tools, whether it's looking and watching how you move in a squat, a lunge, a balance, or whether it's listening to your history of kind of breaking down cause and effect. What's a cause and what's the effect? Joint position, muscle tendon imbalances, and muscle inefficiencies are all things that can lead to pain and problems. And having methods and tools to sift through that is one way that we can be effective with your back. Next slide. Doc, what about these concepts of activities, of trigger points? What you're seeing on the screen with these red dots, you're seeing that the X's are the areas of primary pain. So if we look at the lowest left-hand corner, you're seeing somebody's picture of the spine, you'll see an X. And those X's are the source of pain. And those red dots are where pain can be sent to or towards. So they've mapped this out in the body. X marks the spot, that's the problem, but you don't feel pain there. You feel where it is sent to or referred to, and those are the red dots where those pain patterns are coming to in all those pictures. So overloads, imbalances, dysfunctions in one area of the body trigger pain to be sent to another area of the body. Easier for me to show my shoulder here. So if I have a dysfunction here, it could manifest with pain down in this pattern right through here. If I have a dysfunction here in my shoulder, it could manifest with pain here that could present as a headache for the low back. If I have a dysfunction somewhere here, it could present with pain in my butt. Next slide, please. So we're going to show you a couple simple tools that we like to utilize at Airrosti. My rehab specialist, Chris, he's going to take care of that. We're going to show you a couple for the glutes, a foam roll exercise for the glute, a stretch for the glute, and using lacrosse balls. So we're going to go 3-in-1 special here. I'm going to flip this down here. We're going to show Chris down on the ground. Hopefully you guys can see him. Chris is going to sit on top of the foam roller. He's going to cross one area of the body over. He's working on his right gluteal area, this right glute right here. He's going to hold steady pressure, and that steady pressure, he's going to hold on that area for somewhere about 30 seconds to about a minute. And let's fast forward. So let's just say Chris found an area of tightness and tension, but there's multiple spots. You can then proceed with a little bit of oscillation. He's just rolling over the foam roller up and down here just a little bit. And he rolls up and down the foam roller here. He's getting a little bit more surface area covered. So holding a specific spot is an acceptable and great strategy, and oscillating, rolling up and down is another acceptable strategy to try to reduce that pain. What he's looking for is areas of tightness, tension, called a cobweb or a knot in the muscle. We can likewise just ditch the foam roller, and we can use a little more pinpoint specific objects. So this is a lacrosse ball. You can use a tennis ball, a lacrosse ball, or another durable object. And what Chris is going to do is Chris is going to go up against the wall. And what he's going to do is just put direct pressure. Let's see here. He's got direct pressure right in that gluteal area. Let's bring that camera up just a little more time. You can show where you're putting that right into that gluteal cavity up against the wall. So that's another really simple exercise that you can utilize to try to reduce knots, adhesions, tightness, tension right here in the glute, holding steady pressure or oscillating back and forth here. The last major one is we call figure 4 stretch. This is when a patient is sitting up in a chair, nice and tall. Good. Here's the key to this exercise, is to keep the chest upright, so no slouching. Cross this over here, kind of lean forward, rock forward here without slouching. And what he's going to feel is a stretch here, this posterior glute. So that's the correct way of doing it, and he's feeling a pretty good stretch. The incorrect way is if he starts to slouch down, he's going to lose that stretch right there in the glute, right here in the buttock. But if he's upright, go ahead and Chris, raise your torso just a little bit. That stretch returns right through here. So this figure 4, or the executive stretch, we can all pretend that we're the high-powered CEO of AISD or Dell or something like that. All the executive stretch is a really good way of mobilizing that posterior portion of your buttocks, your glute, that pain and tension in that butt during the course of that day. Next slide, please. So chair stretch, full disclosure, I don't like to utilize this stretch. It can be used to get a little more mobility. I'll show it here. I have a tendency to think that people like to twist at the end, grab onto the chair, and really kind of torque their spines. And that's not the best idea. So I'm going to demonstrate this with the caveat. Please do not kind of grab onto something and kind of twist and torque your spine. It's not meant to be moved like that unless that's the goal of the exercise or the goal of the procedure. For most folks, this is not a good thing. So go ahead and sit up upright. Just rotate your torso into the resistance. hold it. Do not thrust or do not forcefully move your torso past the barrier. This is trying to get mobility right through this mid portion of the spine, trying to loosen right through there on Chris. And Chris can hold this about 30 to 60 seconds. Go ahead, Chris. Let's say we go the opposite way. Same thing. He's trying to get mobility through this part of the spine, just gently holding it 30 to 60 seconds. Okay. Again, do not like rotate, grab onto something, and quickly try to thrust or move your body. That's the misconception that we see with the stretch here. All right, next slide, Chris. And hip flexor stretch. We like utilizing this for lots of different purposes. The purpose that we like utilizing this guy for is that we are products of our environment. And if our environment is sitting over the course of a day, our hip flexor, this muscle right through here, our hip flexor gets tightened and shortened over the course of the day. So if our hip is in a flex position and we're leaning forward in the chair over the course of the day, this is a great tool to elongate that muscle and lengthen it. Now the hip flexor attaches to 3 areas of the body. It attaches to the back, it attaches to the pelvis, it also attaches to the hip. So elongating that area can often affect the hip, pelvis, and low back. It's a 3-for-1 trifecta special, right? So the reality of the situation, if it's 3 areas of the body that it's affecting, it's critical. So we like recommending and prescribing this. Chris has one leg behind the other. Let's get that camera angle down. What Chris is going to do is take his pelvis and pretend like a bucket of water. He's pouring water out of the back of the bucket, so he's tilting that underneath. Chris is going to rock forward, keep that tilt. He's going to get a little bit of length and stretch, and then we can add to it by having Chris go vertical. Go ahead, Chris, touch the ceiling. As he tries to touch the ceiling, he's getting a little bit more length right through the front portion of the hip. I usually recommend that he holds it somewhere in the vicinity of 30 to 60 seconds. There is a standing version if you do have knee pain. I usually recommend folks can stand up. Same thing, one leg in front of the other. Take this, rock forward here, reach towards the ceiling. Right, he's getting a little bit of length. And when he goes vertical, he's increasing this amount of pull that he has in the front of the hip. Next slide. One more little tidbit, one more little point here. We'll make sure we answer any questions. We'll do that all at the end of the session. I'm more than happy to sit down and answer any question. Again, no private health information. We do have that virtual chat option, which is great if you need something a little more specific than what we can give you. But picture that you've been sitting in a chair all day long, right? Who would have thought? But also picture you've been sitting in a car all day long on a long car ride, maybe going out to New Mexico or Colorado or wherever you're going to spend your spring break. So another real simple stretch is just to break up that sitting position. And all we simply do is we call it the get out of the car stretch. So Chris, pretend like you just got out of the car. You just simply make yourself tall, reach towards the sky, that beautiful Colorado sky. And as you do, you're elongating your hip flexors, you're elongating your erectors, you're stretching out your shoulder muscles because you've been driving in this position for hours and hours and hours. We can use that and recommend that every 30 to 45 minutes of sitting, maybe simply just reaching to the sky is a simple solution that you can use and hold it really rapidly to try to reduce some of the stress that your back and body feels from that cumulative position, that cumulative small trauma. All right, that's all I got. Let's turn it over back to Chris Jammer. Thanks everybody for paying attention. Thanks, Chris.
All right, thank you, Dr. Pappas and Chris, for going over those conditions with low back and giving us a better understanding of exactly the mechanism and where those injuries and aches and pains come from. And thank you, Chris, for demonstrating those exercises for us. So, of course, to talk a little bit specifically more about Airrosti, so as Dr. Pappas talked about the different mechanisms of injuries, especially with lower back injuries, that's basically what we do in clinic. So as I said before, we take care of soft tissue injuries. So because of what we do in clinic, where we couple what we call a myofascial release therapy, which is what Dr. Pappas actually does, and then we couple that with active rehabilitation, we only have to see our patients about 3 times to get you to total pain resolution. So as you can see, as of March of 2021, we've seen over 1,000 different patient cases. And kind of our claim to fame is that we like to help people who avoid surgeries, or if they are scheduled for something, or if they might have gone to see a specialist before, maybe receive some general chiropractic care or traditional physical therapist care. If you've gotten to a place where you know what, we can't necessarily get you totally out of pain, or you still coming in with some pain, we want to do it to where we're making sure that, number one, you're in the right place and it is something we can take care of. And we don't want to continually be in a hamster wheel of healthcare where you're doing the same things over and over and over. So because of that, about 9 out of 10 of our patients, regardless of any type of injury that they come in to see us, will report a full recovery. And also 99.5% of our patients would recommend us to family and friends. So there's a small percentage of people, about 10, 11%, that walk into our doors, not necessarily that we can help as far as a treatment plan, but we always like to get you to the place that can help you. So we can't help you in our offices. We always will direct you into the place that can get you the help that you need. So today, Dr. Pappas talks specifically about lower back pain. But we see different conditions all the way from your head to your toes. So it could be something acute, maybe like an ankle sprain or maybe a hamstring pull, or it could be something chronic in nature that you've been dealing with for months, years, decades on end. Something like maybe carpal tunnel, neck pain, maybe some headaches, or even plantar fasciitis, of things of that sort. So, and lastly, we are an in-network benefit for all of Austin ISD's Aetna Health Plan members and dependents. You don't need a referral to go see any of our providers, and we have over 40 providers in the Austin area with over 30 different locations. Dr. Pappas's office is right off of Mopac and Far West in one of our newer standalone locations. All of our clinics are currently open and making sure that we adhere to the recommendations of the CDC, not only to make it a safe place for our treatment teams and for all of our employees, but also for all of our patients who come in. If you would like more information on Airrosti in general, you can visit us at airrosti.com or call the 800 number. But again, if you guys have any general questions about the content that Dr. Pappas and Chris went over in the presentation, for sure shoot those over in the chat. And for those of us who joined a little bit later after the introduction, if you have not sent over your first name, last name, or in your employee EIN number, could you send that over to me so I can make sure that you all are awarded your wellness points by Lee and Jamie? So thank you all again for joining us, and we will stay on for questions. And yes, we will be providing some resources and a follow-up email with the information that we went over today.